Bringing a new life into the world can be scary enough for many people. Add coronavirus concerns on top of it, and it can be terrifying. Dr. Maria Cimbra examines how the pandemic is affecting pregnant women when it's time to deliver.
For expectant mothers, the risk of coronavirus affects many aspects of pregnancy.
It is a situation that is changing daily. So initially it was social distance, stay away, wash your hands. But now, of course, we're understanding that this is far more intense of a situation.
There's the possibility of separation after giving birth.
The CDC is recommending, out of abundance of caution, for mothers that have the infection, or if there's a mother who we think may have the infection, and the test is not back yet, that until we know that, we do some separation.
There's also a shorter stay in the hospital, just 24 hours in some cases.
And it turns out that most patients actually do want that. This is for women and babies who have no signs of a problem and can safely go home.
I'm a first-time mother, so I am going to need all the help I can get.
What we don't want to do is send someone out who doesn't have what they need at home.
As for complications to mother and baby because of coronavirus, the information is still coming in.
To date, we do not have any evidence that pregnant women are more likely either to get the infection, or if they get the infection, get worse, have a worse time with it, or have worse outcomes compared to non-pregnant women their same age. In terms of the baby, there's still inconclusive evidence, and there's no definitive proof that the mother, if she becomes infected, can pass that to the baby while she's pregnant.
Also, the CDC does not know if the current coronavirus can be transmitted through breast milk. In Bridgeville, I'm Dr. Maria Cimbra, KDKA News.